This is a 10-minute video demonstrating the HS2 ultrasound scanner. Let's begin by looking at the anterior tibial tendon in the longitudinal axis. Here you're demonstrating the tendon. As you can easily see, this is the probe position. And within the image you should easily see the fibrillar pattern of the tendon. Those are the fibers of the tendon. Let's now change the probe to the transverse axis. Again, here I'm running the probe proximal to distal, transversely, and now I'll show you the probe position. Here I am right over the anterior ankle. So one of the nice things you can do is actually split the screen so you can see the tendon in both the longitudinal and the transverse plane. The HS1 actually has a beautiful image in that it gives you a very long image of the tendon in the long axis, and at the same time you can clearly see it in the transverse axis. Now, labeling the structures are really easy. On the left hand side you can see there's a menu where we can choose probe position, then we can choose the laterality, and then also whatever the structure may be. Here I'm labeling longitudinal left anterior tibial tendon, and on the lower half of the screen I have the transverse of the same tendon. Also, you can notice that there is a keyboard, and you can type anything you'd like on the keyboard, which ends up directly on the screen. Once the annotation's on the screen, you do have the ability to move it anywhere you want and locate at different spots on the screen. We are now looking at the posterior tibial tendon there in the longitudinal axis. Again, the clarity of this machine is just unbelievable. Here we're imaging at 18 megahertz. You can clearly see the borders of the tendon. You see a little fluid on the side of that tendon there. Transversely, you're looking at two tendons. You have the posterior tibial tendon and the flexor digitorum longus, and this is basically the position. That was the long axis, and now you're going to see the transverse axis. Next, I'm going to now demonstrate the split screen once again, and then show you how easy it is to label the structures on the screen. Again, labeling is really quite easy. If you really look at the image here, look how clear that you can see the tendons. Of course, you could see the tendons in the transverse. You could tell if there's any tears or partial tears of the tendon. Here I'm moving the keyboard. I just wanted you to show you that you can move the keyboard around so that if it seems to be in the way on the bottom of the screen, you just take your finger and move it to the top. It is a touch screen monitor. Now, directing the attention to the retrocalcaneal surface and the Achilles tendon. If you look at the screen, to your right is going distal, to the left is going proximal. Here I'm going proximal. I'm looking all the way deep, all the way down to the surface of the tibia. I've now switched to transverse, and you can see the beautiful image of the tendon. You can see the edge shadowing. Again, going now in the long axis again, I just want to show you that you can look deep down into the posterior aspect of the Achilles tendon down to the flexor lucis longus muscle and actively see it move. This is basically the position of the probe in the long axis, and here we are in the transverse axis. Okay, we're going to now take advantage once again of the split screen so we can see the longitudinal and the transverse on the same screen. Something a little bit different this time. We're going to now show you the measurement menu after they're labeled. So if you look on the left, this is now the measurement menu. You have your choice of distance, ellipse, and tracing, and all the different functions that become available when that menu's open. In the split screen mode, you'll notice that the measurements are displayed up in the upper left hand corner. Each one is displayed after you complete the measurement. Okay, let's now move on to the medial aspect of the ankle, and we're going to demonstrate the tarsal tunnel. In this view, you can see the two tendons, the artery vein and the posterior tibial nerve, and even the laciniate ligament, the flexor retinaculum. Here I'm demonstrating the view, and now we're going to apply the color box to this so you can see the flow in the artery. If I squeeze, you just see the veins. So you can augment flow, and now I'm in power Doppler, which is a little bit more sensitive. Let's now freeze the image on the screen and label the structures within the tarsal tunnel. Let's begin with what view it is. It's a transverse tarsal tunnel, of course. I want you to particularly pay attention to the white structure to the left. That's the posterior tibial nerve. Those little black dots are actually the fascicles of the nerves. You see the PT tendon, flexor tendon, and the artery, vein, and nerve. I think you're starting to see how great the image quality really is. Let's direct attention to the dorsal aspect of the foot at the first MPJ. This is the position of the probe in the long axis. Some of the things you might look for here is to look for range of motion. You could look at a hallux limitus. You can see exostoses coming from the joint. You could look for a joint effusion. If you run the probe along the shaft, you can evaluate for a stress fracture, which shows up immediately. You don't have to wait 2 weeks like on an x-ray. Let's now move the probe to the plantar aspect of the foot. But the first thing I need to do is change the settings. So what I did there is I have my presets, and I just basically told the machine to go a little bit deeper and a little bit more power to get through the plantar aspect of the foot. In this case, you're observing the metatarsal shaft. As you see, I'm going proximal. There's flexor lucis brevis muscle. There's the metcuneiform joint. This is the view actually that you're seeing on the plantar aspect. Now moving the probe distal to the metatarsal phalangeal joint, you can see the base of the proximal phalanx, the joint capsule, the plantar plate there. I'm going to move the probe medially to demonstrate the tibial sesamoid, go back laterally in between, and now lateral to the fibula sesamoid. Let's now turn the probe transversely, where now you'll see on the plantar aspect the flexor hallucis longus tendon transversely, the fibula sesamoid, tibial sesamoid, and the surface of the crista. If we split the screen and flip in the long axis at the same time, now you're looking basically between the two sesamoids in the long axis, where you see the long view of the flexor hallucis longus tendon and the joint capsule. Sticking with the plantar aspect of the foot, let's go proximal under the calcaneus, which you see there on the left, the surface of calcaneus, and you'll see the fascial bands, the inferior surface and the superior surface. We go distal, you see following the band as it goes toward the middle of the foot. This is the probe position in the long axis. Let's now freeze the image, and we're going to measure the thickness of the plantar fascia. I begin now by hitting the measurement button, and there you'll see the measurement menu. I click on the inferior surface. I go to the superior surface. Remember, this is inverted. The plantar fascia is inverted, and you can measure it at 4.6 millimeters. Let's talk briefly about ultrasound guided injections. The HS1 has a special mode where you press this and it turns the tip of the needle a bright blue. Here I'm injecting or sticking a 25 gauge needle into a tissue phantom. Just check how bright the tip of that needle is. So by now I'm sure you're recognizing the image quality that the machine has. Right now I would like to demonstrate that honeycomb structure in the center top portion of the near field. That is the median nerve of my wrist, which is only 2 millimeters below the surface. Note that I'm not using a standoff pad. That's how clean and outrageously beautiful the image quality is on this machine. You've now seen normal things. Let's look at some pathology. I'm going to run through this very quickly. First, let's start with a thickened plantar fascia, 5.5 millimeters. Next, let's look at a plantar fascia tear. You can see that anechoic area right at the calcaneus is a partial tear. Here I'm showing you injection of the plantar fascia transversely. The next image is a plantar fascia rupture. Notice it's just disorganized and chaotic. Here's a nice image of a tendinitis. Note the fluid on the tendon. This next image is that of a neuroma in the long axis. Yes, that dark hypo to anechoic structure. Okay, the next structure is now a partial tear of the Achilles tendon, which you can see it's labeled where the arrow is. This next picture is a picture of a plantar plate tear of the second metatarsal phalangeal joint. This next picture is a tenosynovitis of the anterior tibial tendon. Our next image will be a ganglion cyst, and note the septa within the ganglion cyst. Here's a partial tear of the anterior tibial tendon in the long axis. Let's rotate that 90 degrees, and the same tendon as you can see in the transverse axis. That concludes the 10-minute video. If you have any questions or needs, you can contact me using the information on the screen. One of the nice things about 2020 is that I actually come to the office to teach you how to use your ultrasound scanner.